UDS requirements for weight assessment and counseling for nutrition and physical activity for children and adolescents. What UDS requires. Patients 3 to 17 years of age must have some sort of counseling for both nutrition and physical activity at least once during the current measurement year. The measurement year is from January 1st to December 31st. BMI percentile must be documented in the same progress note as the nutritional physical activity counseling. Charts are audited for this measure electronically. Hand audits are no longer allowed by UDS. The electronic reporting system, which is called Bridget, will look for flags in the progress note to indicate that the needed diet, weight counseling was done. What the UDS report looks for. It looks for a document BMI percentile and one of the following flags in the same progress note. It will look for either two assessments codes, neither have to be primary in the same progress note. Z71.85, which sometimes will read other specified counseling, sometimes will say physical activity counseling, and Z71.3 dietary counseling. Or a structured data section in preventive medicine. Let's see about how we can add a flag in preventive medicine. What steps does it take to do that? There's a template, BBCAA, diet, exercise, counseling, not BMI specific. If you save this template to your favorites, it will be usable from the right-hand chart panel, and simply by clicking on the arrow, it will cause this following section to populate into the progress note. It will be the needed flag plus a little basic narrative to go along with it. Additional documentation can be added to any section of the progress note if desired, but the above flag must be present along with the BMI percentile to get UDS credit. So if we're in a progress note, we have a child here, age of 6. We have the BMI percentile because we had both the weight and the height listed. With 2 clicks, I can add that needed flag into the preventive medicine section. And this is how you do it. First off, you click on the templates tab, and I have saved my template here as a favorite. And if I simply click on the arrow, it will pull that needed flag into my progress note along with a little additional narrative. I can add more to this if I want to, but this is the bare minimum you need to meet the requirement. Now let's look how we can add a flag into the assessment section of the progress note. Using the same template that we have saved, by clicking on the plus sign, it will allow us to open up an order set and drop 2 assessments into the progress note. Both of the assessments must be present along with the BMI percentage to get your points. However, this part, though it takes more clicks, is not as clean. It does allow you to generate some meaningful use points. And let's see how this part works. Okay, let's look at adding the flag through the assessment. So I've entered the height and the weight, and we got our percentile. I come over here to my template, and for my little adult diet and exercise counseling template, I click on the plus side. That's going to open up an order set. And just a reminder, I need to check both of these, the Z71.3 and Z71.89. Now this one may have a little bit more specific wording on it, but the report's looking for the actual number and not the wording. So don't let that throw you off. Okay, when I click OK, I'll give it an order set. Here's where I can document. I gave handouts. I don't need to print from this page. I can have these pre-printed, but this is a way to document and get meaningful use points for giving handouts. Then at the bottom, I have some 4 little options you can check. This will dump some narrative into the assessments. And the black is based on diet, and the brown is based on physical activity. So once I have everything in I want, I just click order, and let's see what happens here. We have our assessment codes. We have our treatment. Now, this is where it gets a little messy because it's going to have the same thing twice, the same thing under both assessments. But what I have documented that we gave them a handout, I got my meaningful use points, and then it dropped in the little verbiage that I added also. Not pretty, but gets the job done. Okay, let's review some points about that. Remember, nutrition and physical activity counseling can be initiated and completed by the nursing staff. Pre-selecting handouts can speed up counseling If given to the patient when nursing staff leaves the room, patient can review while waiting for the provider. Counseling for nutrition and physical activity must be done at least once during the current measurement year. And BMI percentage must be documented in the same progress note as the nutritional and physical activity counseling flags to get credit. And currently, the preventive medicine flag populates when using a well-child checkup template for 3 years and up. Okay, just one little point I want to make here. This needed education has to be done once per measure. Even though the flags are part of the well-child checkup templates, and they are going to be covered at a well-child checkup, don't rely on the patient coming back in for well-child checkups to get this done. Once per measure is not the same as just covered well-child checkups. Let's look at an example. We have a 6-year-old kid who showed up, say, December 15th for a well-child checkup. At that visit, the template pulled in the flag. We did some counseling, and so we took care of the physical activity, dietary counseling at the well-child checkup. Kid comes in February for a sick visit during the current year. Comes in again in March for some allergies. And neither time did we do any physical activity counseling or dietary counseling because we're thinking we're going to get it when they come back in for a well-child checkup. However, due to some scheduling problems, they didn't make it in until January. So the points that we traditionally do the counseling were not within the current measure year, so we didn't get credit for it. So don't just rely on getting this covered at well-child checkup visits. Any visit is an opportunity that this can be done.